Welcome back to Inhibition. Today's topic, universal health care. Is it government salvation or is it government slavery? Is it really the answer to what America needs? We're going to look at the facts, the data, the evidence, and we're going to determine if Medicare for All and universal health care is our answer, or do we need to kick the government out of health care to make it better? It's time we talk about it. Alright, welcome back to the channel. Thank you so much for joining us today. We're going to jump into the topic, but before we do, go ahead and hit that subscribe button and hit that notification bell if you're interested in topics like this. We post videos every single week, specifically on Tuesdays, Thursdays, and Saturdays. On Thursdays, we actually just started a new series talking about propaganda in media, some shorter form content where we're just breaking down some lies and propaganda that we find in the media. So you don't want to miss that. Hit that notification bell after you hit subscribe to make sure you don't miss a video. Now let's jump into it. Universal health care. Is this the government salvation coming in and fixing all of our issues, or is this really slavery to the government? We're going to break down the details, but first we just need to know, what is universal health care to begin with? That's a very common phrase you'll hear, but some people hear it and they don't really fully understand it. Technically speaking, according to the World Health Organization, UHC or universal health care means that all individuals and communities receive the health services they need without suffering financial hardship. It includes the full spectrum of essential quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. In other words, from birth till death, that you would be covered without suffering any financial hardship. Now, I will say that there is different types of universal health care done across the globe. Different countries do it a little bit differently, but the idea is that everyone, all citizens of the country, get health care, and also it would not create a financial hardship for them. Now, some do that as completely free, some do it as very regulated, private health insurance, different things, but universal health care is everybody is covered. For what we talk about here in America, for what most people refer to when we're talking about universal health care in America, it is health care provided and paid for by the government and made available to all citizens and non-citizens of a country. In other words, it is government-ran healthcare, and it's paid for by the government. Now, of course, we know that the way the government gets money to pay for anything is through taxes, so it's taxpayer-funded healthcare that covers everyone universally. Now, that's what universal healthcare is. In America, there are some aspects to universal healthcare that we need to look at. First, it is government-ran. That's important. It is government-ran. It's also government funded. Now, the difference between government ran and government funded is where the money comes from. Government ran is policies. Because they have their money involved, they are going to regulate it and create policies that run that healthcare, that govern that healthcare. So it's government ran and it's government funded. The money's coming, of course, from taxpayer dollars. It's also available to all. That makes it universal healthcare. So it's available to all. And it's also, when in America, what we refer to as universal healthcare, we're talking about free at the point of service. So when I go to the doctor, I don't get a bill for copay, deductible, nothing. I get no bill, completely free at point of service. Now, free at point of service is not the same as being free. We all like the word free, but free at point of service does not mean that it didn't cost anything. It absolutely cost something, but it was paid for out of my taxes. So it is free at point of service. This is the key elements to universal or government-ran healthcare. Now, we have some government-ran healthcare in America already. For example, we have Medicare. Now, Medicare is government-ran healthcare. It's regulated by the government. The rules are made by the government. It's government-ran. However, Medicare is not available to all. Specifically, Medicare is available to people age 65 and older. You can also get Medicare if you are disabled, and you can also get Medicare if you have end-stage renal disease. Outside of those issues, you can't get Medicare until you turn 65. So it's government-ran, but it's not universal healthcare because it's not available available to all, and it's not completely free at point of service. We also have what's commonly referred to as Obamacare. This is the Affordable Care Act. Now, this is something where the government got involved in healthcare, but it is not universal healthcare. It's government regulated, not necessarily government ran, but it is government regulated. There are rules from the government on Obamacare and on the policies that qualify under the law. So there is regulation from the government, but the government doesn't run it. It is still handled by private insurance companies. And it is partially government funded in the sense that there are government subsidies and things that help cover the premiums for people who qualify. So, of course, that's been done away with under the Trump administration, but that was something that came along with Obamacare. It's kind of available to all, sort of, in the sense that everyone across the country has these marketplace or Obamacare policies that they could purchase. So it's available to all in that sense, but it still has to be purchased. And since the government subsidies existed, if you couldn't afford it, there was a subsidy to help cover it. So kind of available to all, but it was not government ran. So it's not true universal health care. And it also was not free at the point of service. If you have a policy purchased off the marketplace or the exchange that was set up under Obamacare, you still may have deductibles, co-pays, things like that. So it is not free. Now, there's this new topic that everyone's been talking about, which is called Medicare for All. Now, Medicare for All, it is taking the Medicare program, expanding it, and then offering it to everybody. So you wouldn't have to wait until you're 65. You wouldn't have to be disabled or have end-stage renal disease. It would be available to everyone. It is government ran. It would be government funded through taxes, and it would be available to all, and it would be free at the point of service. So that would be true universal health care. And there is a big push for Medicare for All from many in our government. Now, we're not there yet. People have not accepted Medicare for All, but it is something that people are talking about. Now, there's other options, things I didn't list in here. We got Medicaid, which is a government ran insurance. It is government funded as well. And actually it is free at point of service as well. You don't have co-pays and deductibles with Medicaid. It covers everything. However, it is not available to all. So Medicaid is not true universal. So out of all these options, Medicare for All is the first true single-payer universal healthcare option that has really been presented as a bill in government. This is being pushed. There are mainstream people pushing for the idea of Medicare for All. Let's listen to some of them.
They go to the doctor and they find out they thought they were covered, they're not covered. They have to pay out of pocket. 500,000 people go bankrupt because of medically related bills. People go crazy filling out forms. Doctors are sick and tired of having to pay attention to the insurance companies rather than their patients. This system is dysfunctional, it is cruel, it is wasteful. We have got to join the rest of the world, move toward a Medicare for All type program.
So now the resistance has to step forward. We need to do two things, Chris. Number one, we need to push for single payer insurance, Medicare for all, the kind that Canadians have, the kind that every other civilized democracy on the planet has.
Is that we have a healthcare system that literally causes people to die. We have a healthcare system where people are paying 10 times more for insulin in the United States than they do in Canada. We have a healthcare system where 500,000 people every year file for medically related bankruptcy because of medically related costs. So this is untenable. The system as a whole will cost us $55 trillion over the next 10 years. So the question here becomes, why would you protect the status quo? And how do we make sure that every single person has universal care?
So you can see that there is this push for Medicare for All, and they point out the problems in our current system and say, see, here are these problems, and the answer is Medicare for All. The answer is universal government-ran health care. So when it comes to Medicare for All, there are really two main claims that you're going to hear. You're going to hear that it's cheaper for Medicare for All, and where they get this from, the estimate that they have for Medicare for All is that it would cost $38 trillion over the next 10 years, but the estimate for the current system of healthcare that we have costs Americans $45 to $55 trillion for the next 10 years. So what they're saying is, see, even though Medicare for All is expensive, it's cheaper than our current system. And so they'll claim it's cheaper. The other claim is that it has better healthcare outcome. And they'll talk about how these other countries that have, different different types of universal health care have longer life expectancies, lower infant mortality rates, things along those lines. And they'll say, see, the health outcomes are actually better in these other countries as a result of the fact that they have universal health care. We're going to look at both of these claims and see if they are actually indeed true. So first of all, let's talk about, is it actually cheaper to have Medicare for all? Is this actually a cheaper option? Well, first of all, there's a phrase that you get what you pay for. Now we're gonna break down whether it's actually cheaper or not, but it's important to understand that cost is not the only thing that we need to look at. It is also important to look at quality. For example, if I go to the store, and let's say I'm going to the store and I'm looking to buy a phone, and there's a couple of different options for my phone. Now, I could spend less money and buy a cheap smartphone, something on the cheaper end, maybe an off-brand, not a big brand name. Just get a cheap little phone. And let's say I spend $100 on that phone. Now, I can also go to the store and I can put $600-700 towards a phone and get a phone that is a lot better. Camera quality's better, the battery life is better, sound quality's better, quality of the phone itself is just better. Now, if we're going by cost alone, you would look at it and say, oh, this person spent $700 for a phone, this person spent $100 for a phone. Obviously, the person who spent $700 for their phone, that is terrible. It's horrific that they would have to pay that much when you can just pay $100. Everybody should just have to pay $100. $700 is outrageous. But what you're not factoring in is the quality of what you're getting for how much you spent. Yes, it is expensive. Healthcare in America is expensive. And the truth is, it is way more expensive than it actually needs to be in some areas of that healthcare as a result of government interference and regulations, which we'll talk about later. But the important thing to understand is that you get what you pay for. And sometimes, while we may pay more for healthcare in America than some other countries, our quality of healthcare is actually better in America. And we'll look at that in just a few minutes. But you get what you pay for. But there's some important keys about whether or not this is actually cheaper. So let's talk about Medicare, because we're talking about Medicare for all. Let's talk about Medicare. Now, I know that there's been talk about expanding Medicare and, covering dental and vision under Medicare, things that are not currently covered under Medicare. Medicare's got a lot of problems, and it's not a great thing. I know everybody talks about Medicare. Oh, Medicare, we have Medicare, you pay into Medicare, and you get to have this, benefit once you get old enough, age 65 and older. But in reality, when you look at what Medicare actually covers and all the rules and regulations to it, and how much you actually end up paying out of pocket, it's not the best system. But there is talk about trying to improve those things and then making it available to all, which is Medicare for all. But what's interesting about Medicare is that Medicare covers only 90% of the total allocated cost of care. What do I mean by total allocated cost of care? Well, let's say if a service, let's say some service a doctor's providing to a patient, costs $100 to provide care to that patient. So it costs the doctor, it costs the hospital $100 to provide the needed care to the patient. The doctor or the provider, which is the person providing the services like the doctor, is only going to get paid $90, but it costs them $100 to provide that service, but they're only going to get reimbursed $90. So they're getting underpaid under Medicare. Currently, the providers make up that difference by overcharging commercial private insurance. So they will actually charge the private insurance more. This is called cost shifting. And private insurance gets charged about 120 to 130% of what Medicare pays to make up the difference. So that service that costs $100 to provide would cost the private insurance company $117, and that makes up the difference for what they lost out of Medicare. Let's see how this works practically. Let's look at an example. So here we have a doctor, and we're just going to call him Dr. Smith. Dr. Smith has two patients. He has Sylvia, and he has Jesse. Now, Sylvia has Medicare. And so she goes to the doctor. Let's say we use that $100 number. She has a care that is provided to her from Dr. Smith that costs $100 for him to provide this to her. But Dr. Smith only gets paid $90 because it's Medicare. Jessie, on the other hand, she has a private insurance. And again, same cost of care, $100 to provide the service to Jessie. That's how much it costs. But Dr. Smith gets paid $117, which is overcharged from what it cost him, in order to make up the difference for what Medicare underpaid. So in this scenario, the total cost of care for both patients was $200. Total payment that Dr. Smith got was $207, and so he walks away with $7 profit. And this is called cost shifting. It takes the amount that they should have gotten paid from Medicare to break even and kind of basically adds it into the private insurance's payment to make sure that they get paid more with a little bit of extra, obviously, to pay their bill. And so that's how it works. Now, let's look at what that would be like under a Medicare for All situation, where both Sylvia and Jesse have Medicare. Well, Sylvia, her situation is going to be the same, $100 for the cost of care, but Dr. Smith only gets paid $90. But this time, Jesse doesn't have private insurance. She also has Medicare, and it's $100 for the cost of care, but Dr. Smith's only going to get paid $90 for Jesse as well. So in this situation, the total cost of care is $200, but this time, Dr. Smith's only getting paid $180, meaning that he's operating at a loss of $20 for these two services for these two patients. Now, you can see how that would add up over multiple patients and multiple services to be a major loss in revenue. And this isn't just loss in profits. This is complete loss. You're spending more to provide the care than you're making by providing the care. And therefore, you can't even break even or come out neutral. You're losing money. You're operating in the red. And some people say, well, but that's based on current Medicare. Currently, Medicare, pays 90% of the cost of care. But that could change under Medicare for All. Okay, yeah, we can make that claim that maybe they'll try to change that under Medicare for All. Although the current or the bills that have been introduced for Medicare for All, including by Bernie Sanders, those bills didn't fix that. That actually said that it would continue to pay that same Medicare rate. So no, it actually isn't going to change under Medicare for All. But let's just pretend it did. Well, that's important to realize because the estimates that they're saying will cost Medicare, they're basing that on current Medicare reimbursement, which is that same rate of paying only 90% of the cost of care. So Bernie Sanders and AOC promoted the $38 trillion number by referring to a working paper called The Cost of a National Single-Payer Health Care System, published by the Mercatus Center at George Mason University. So they reference this, and that's where they get their $38 trillion number. However, the author of the study, which was Charles Blehaus, and I'm probably butchering the pronunciation of that, but Charles Blehaus, a senior research strategist at the Mercatus Center, says that they are distorting the findings of his paper. The paper actually says Medicare for All would, under conservative estimates, increase federal budget commitments by approximately $32.6 trillion during its first 10 years of full implementation. So that isn't the full cost, but rather their added federal budget commitment. According to the paper, even doubling all currently projected federal, individual, and corporate income tax collections would be insufficient to finance the added federal cost of the plan. The paper, Sanders and AOC are saying, it's only 32 to $38 trillion. So, that's less than we currently pay with our current system. So that means it's cheaper, but not if it's coming out of taxes. And again, that number is just the additional that the government would have to pay on top of what the government already paid. And it says, and according to that same exact paper that gives that quote, it says that you would have to double all federal, individual, meaning everybody, every single person, your income tax would have to be doubled, as well as all corporate income tax. And even that would be insufficient to pay for. So no, while the number may be lower when you just quote that number, when you actually start looking at the details, it's not cheaper. Blehaus actually wrote, it is likely that the actual cost of Medicare for All would be substantially greater than these estimates, which assume significant administrative and drug cost savings under the plan, and also assume that healthcare providers operating under Medicare for All will be reimbursed at rates more than 40% lower than those currently paid by private health insurance. In other words, they're going to take a loss. They're going to go to those lower Medicare rates. So this leaves a couple of options with Medicare for All. Number one, Medicare for All pays more, which would cost a lot more than being claimed, which would drive taxes up on everyone, not just the rich. Or two, hospitals, doctors, etc. can't stay open and provide the same quality of care that they currently offer. So either the doctors would pack up and quit and leave, or be done, or they would have to stop offering as good a quality of care because the cost is too much. That's actually happening in Canada right now. In Canada, we're seeing doctors leave. This is from CBC, which is a news in Canada. It says doctor shortage worsens after 4 family doctors leave Campbellton region. 5,000 patients were left with no primary care providers after the departure of those 4 doctors. There's a shortage of doctors. Ormacado, now I'm again butchering that name, hospital, ER, the emergency room, is to close 6 hours earlier each day because of staff shortage. The fact that the emergency room in Canada was closing to begin with is outrageous. It's an emergency room. What if you have an emergency in the middle of the night, right? So the idea that it's closed to begin with is ridiculous. But on top of that, they're closing 6 hours earlier than they were already closing because of a staff shortage. As a matter of fact, and this was as of 4 days ago, this is just a few days ago that this happened. Out of this article at CBC News, it says, doctors warned of reduced hours. The announcement came after emergency physicians in Oromocto and Fredericton warned patients that the hospital will be unstaffed in the evenings because of a physician shortage that has reached crisis levels. It specifically says, in an interview, Segal said the hospital has been grappling with staffing shortages and a physician shortage for years. This isn't just due to the pandemic or anything like that. This is a shortage that they've been dealing with for years. Operating with 12 full-time physicians when it should have about 20. It's near their breaking point. Segal, who does the hospital emergency room scheduling, says that they have been patching up staffing holes, such as by bringing in doctors from St. John or Fredericton, working overtime, cutting into vacation time, but that the situation has become unworkable. That for years they've been battling this. They've been doing things, getting rid of vacation time, working overtime, just overworking the staff, and the staff can't handle it. And the reason why is because doctors aren't getting paid. They're taking losses. They're taking losses in their pay because the government ran healthcare. Again, it doesn't work. It hasn't worked anywhere. And you may think, oh, it worked. Go look at the UK. Go look at Canada. They got free health. Yes, but there's a cost to it that is adding up over time that you're not seeing when you just hear the rhetoric that people speak. So let's look at the better health outcomes claim. Is there better health outcomes? So there is a longer life expectancy in some of these other countries. For example, Canada's life expectancy is 82.66 years, while US is 78.99 years. So yes, we have a lower life expectancy. But why is that? Is it because of the healthcare? Well, we're going to look at that in just a moment and determine if it's because of the healthcare. But you got to remember that looking at life expectancy, you can't just claim it's because of the healthcare as if healthcare alone is the only thing that dictates life expectancy. In America, we have issues like obesity. And obesity isn't just, oh, that's a healthcare issue, you're obese. Yes, it creates health problems, but it isn't the treatment of the health problem that's the problem. It's the fact that we're getting obese to begin with. Taco Bell, Burger King, Pizza Hut, KFC, McDonald's, all these places, we have a huge epidemic of obesity in this country. Canada doesn't have these problems. Yes, they have fast food, but it's not a way of life, so to speak. Almost a way of life here in America. And there is an epidemic of obesity in our country. The other countries that you're comparing life expectancy to doesn't have that. And that isn't about the treatment of healthcare. It's about personal life choices. We have smoking is a huge issue in America. If you actually look at the numbers, studies have been done. Smoking in Canada, nowhere near as high as smoking per capita in the US. So we're creating problems through our personal choices, which are leading to a lower life expectancy. So you cannot just say, oh, it's healthcare. Healthcare is the issue. It's not. And we can see that it's not because we can see other things when we start looking at some actual data. So let's talk about death in healthcare. A study by the Fraser Institute estimated that increases in wait times for medically necessary care in Canada between 1993 and 2009 may have resulted in between 25,000 and 63,000, with the middle number being 44,273, additional deaths among females. Just the wait times, which is an issue with healthcare when it's ran by the government. The wait times are outrageous. And let's just say, take that middle value, 44,000 additional women died. Additional females died because of those wait times alone. Adjusting for the difference in populations, that middle value inflates to an estimated 400,000 additional deaths among females over a 16-year period. This translates to an estimated 25,000 additional female deaths each year in the American system if we were to do the same thing Canada's doing and deal with those same wait times under a government-ran health. 25,000 additional women every year. Interesting that the progressives who claim to care about women's rights kind of overlook this. You know, that's universal health care. Let's kill 25,000 additional women every year. Kind of an outrageous claim. What about the CDC? It says, according to the CDC, stroke is the cause of more than 130,000 deaths annually every single year in the United States. However, the U.S. has significantly lower rates of 30-day stroke-induced mortality than every other OECD country, aside from Japan and Korea. OECD data suggests that the age and sex-adjusted mortality rates within Europe would translate to tens of thousands of additional deaths in the U.S. If America had the 30-day stroke mortality rate of the UK, for example, we could expect about an additional 38,000 deaths a year for stroke. Look at this. This is the 5-year relative survival rates in various cancers, and this is from a study done in 2008. Look at the United States. We are at the top of the list of survival of cancer. Now, how do you survive cancer? Just let it go. No, it's healthcare. Our healthcare system is the reason we survive cancer. And look at this. We're at the top of the list. And you can look at all these other countries that have different types of universal health care, and we're blowing them out of the water. Now, I know Canada is pretty close to us in a couple of these, but look at prostate cancer. We have a 91.9% survival rate. Canada, it drops down to 85.1%. If you look down there at Denmark, Denmark has 38.4% survival rate of prostate cancer. We are 100% leading the world in cancer survival rate. There's also the issue of innovation. Innovation in America under healthcare is important. Yes, our healthcare is more expensive, but it funds innovation. If you look in this screenshot right here, this has to do with medical research papers that are produced. Look at how many the United States produced, 7.8 million. The next closest to us is China, and they are 3.1 million. That is crazy. They are way below us, and they're the second. We produce more research papers on medical innovation than anyone else in the world. You can also look, this is new chemical entities, this is new drugs being produced, new pharmaceuticals being produced. Look here, the US leads the world again, and we have consistently. In 1971 to 1980, we produced 31% of the new drug. In 1981 to 1990, 32%. 91 to 2000, 42%. In 2001 to 2010, 57%. We produce the most drugs in this country, and we export the most drugs in this country to other nations around the world. These nations that have universal health care, they don't have the funding or the ability to drive innovation. They don't have the ability to produce new drugs and to do these. America does because of our healthcare system. What happens when you take that away? The whole world suffers. The whole world suffers. We lead the world in innovation, in medical research, and in pharmaceuticals. Our system is broken, and it's important to recognize that our system is not perfect. We have a lot of issues in our healthcare system that need to be fixed and addressed. The key is, the answer is not more government. More government control. A lot of the issues in America's healthcare system, you can trace back to government. So the answer is not more government. The answer is actually less government. The system is broken. We all acknowledge there are problems with our healthcare system. But universal healthcare and Medicare for All is not the solution. It fails on every front. And that brings us to the end of the video. I hope you got some information out of this. If you enjoyed this video, click that like button and comment down below. What solutions do you see for our healthcare system? We all know there's some problems. Do you see any solutions? Is there any information about Medicare for All you are found interesting that you want to add down below? Put that down below in the comments. Like this video, share the video on social media, share it with others, subscribe if you have not. Thank you so much for watching. We'll see you next time. Thanks so much for watching. For more videos, click subscribe and hit that notification bell. And if you enjoyed the video, click that like button. See you next time.